One of the most difficult and stubborn things to treat is pelvic floor dysfunction. We get very little instruction in that in school. And one of the things I'm going to show you this morning is a couple of little tricks on how to treat two of the muscles in the pelvic floor, and treating them with a technique called counterstrain, or most people know it as strain counterstrain. The muscles we're going to focus in on are the puborectalis, where there's a tender point right on the anterior aspect of the pubic bone. And then halfway between the ischial tuberosity and the pubic bone is a little stretch in the ascending rami right there, and the Ileal Coccidia muscle is right there. And I'm going to show you how to find them tender on the body and the very simple positions that you put them in to release those muscles. And you can even teach the patient on how to treat them themselves. And if you look at a little bit more anatomical view, we'll be palpating right here in the anterior pubic bone. Puborectalis runs right around like a lasso, lassos the rectum and comes back up and attaches to the other side. And then the Ileal Coccidia muscle is attaching right along in here, and that will be tender as well. And I'll just show you how to do the releases on those right now. So I'll have Michelle lie down on the table. To palpate the anterior pubic bone, I've taught you in the past to come down with the heel of your hand until you find the pubic bone, and once you know where it is, you palpate directly anterior posterior on either side, and see if one side is more tender than the other. Let's say her right side is more tender, and what I'm going to do is I'm going to bring the knee up, and I bring it up to at least 90, but usually around 120 to 135, and I try to line the knee up with her axilla. If the knee's lined up with the axilla, I'm almost in the perfect position. And what I do is I palpate, and I can fine tune with a little internal rotation, a little external rotation, a little bit of abduction, whatever, until I find a place where she says, no, that's not tender at all. And all I do is hold that position for 1.5 to 2 minutes. And the nice thing about this is the patient can actually palpate, and actually they can find that perfect position on a couch, leaning up against the side of the couch, where they no longer feel that tenderness, and then they just hold it there for 2 minutes. Now, if we go with the Ileal Coccidia, what you have to do is find the ischial tuberosity, the pubic bone, and right in between is that ascending rami, and that will be tender as well. The position to release is almost the same, but it involves a little bit more abduction, and it's almost a knee's width away from the axilla, and just about the same amount of abduction, just about the same amount of rotation. And again, you find that place where they say, nope, that doesn't hurt at all, and you hold it there perfectly motionless. They're not doing any work. The therapist is doing all the work for about 2 minutes. And then what you can also do is teach the person, just like before, they can hold that leg out just like that. They can palpate that bone, see if it's tender, hold it for 2 minutes. They can treat it at home. Usually 1 or 2 treatments is all you really need to get those muscles to calm down a little bit. Now, I show you these releases and a whole lot more releases using strain counterstrain and also muscle energy technique and some other fun techniques for treating pelvic floor dysfunction. All of it external, no intravaginal